And we're recording again.
All right, off we go. Here we go, guys.
Take 17. Hey, guys.
Hi.
We're coming at you this morning to talk a little bit about back pain to hopefully demystify it. It's probably the most amount of money spent on healthcare in this country, aside from surgeries and other treatments like that, but very prevalent in the whole population. So Ashley and I are going to take you through some stuff. Something we can do with household items. Everybody should have them around the house. So when dealing with back pain and approaching it, you always want to make sure you have a 9-iron, a bungee cord, a bucket of fried chicken. Extra crispy is always preferable. The Rocky training soundtrack, which is good for those montages to really get you pumped up.
Get yourself pumped.
And then Ashley made a great point, your favorite adult beverage. Those are the things that we really recommend to have on hand when dealing with back pain. So if you have any questions about those, give us a shout. All right?
Yep, absolutely. Let us know. All right, guys. So now we're on to the real thing. So we obviously, during this time, we want to keep things lighthearted and keep you guys laughing. I think that's one of our main goals, right, John? So we're going through, yes, for your entertainment. So we're going through some of the main myths of low back pain, and I've done a presentation on this in the past, but I think some of the main things that people typically do is, oh, hey, you know what? When I hurt myself, I need to go lie down and I need to rest. All right. So we don't really want to rest for more than 48 hours, and really 24 hours is key because we want to keep your bodies moving. All right. If we look at number 2, stretching, and John, we can go into stretching a whole bunch, right?
I don't even want to talk about stretching anymore. I'll just say the same thing I tell everybody. In the 8 years I've been practicing, I can't remember the last time I've stretched somebody for the sake of stretching. I'll just leave it at that.
Yeah. And if we do stretch, we make people work first. We make people do things first. A lot of the time what we're finding is people with low back pain love to go into stretching. They say, hey, you know what? This is super tight. And they go, I need to stretch. Or they try to bend forward. Well, sometimes those muscles, all they need is a little bit of rest. They don't need to be put on tension right away, because then you're going to sensitize them. You're going to make them pissed off even more. I typically say, think about a bungee cord, about to break, right? If you go and pull at it and pull at it and pull at it, it's just going to get even more kind of flimsy and loose. Yeah. And that's not what we want to do.
And when you get to understand the nature of the actual injury itself, more often than not, it's a muscular thing or it's a tendinous issue. People say, oh, I threw my back out. Nothing goes out of place. And, I think we'll talk about that. But in reality, it's no different. I like to liken it to somebody pulling their hamstring, or, they strain the rotator cuff or something. So if you think about the muscles actually get a little bit of a tear in them, or the muscle is spasmed up, you don't want to just yank on it. If a muscle is tightened up, you don't want to just, pull on it and pull on it. Like Ashley said, you're just going to piss it off. So in reality, we talk about shortening things, and we'll get into that.
Yeah. So, similar, if your back hurts and it hurts to bend forward and you're trying to go like this, why not try to go this way instead? Give it a little bit of rest. Exactly. Right. Another thing that we talk about is taking anti-inflammatory medication, or just pain medication in general. So we don't necessarily want to do this. Yeah. Right.
No. Okay. I'll be honest. The only thing that we've found that's really beneficial if you're going to pop a pill is the Flintstone vitamins. No, that's really it. But seriously, if you read the blog that we did on this a while ago, there's a good type of inflammation. Ashley, wrote that bullet in the post, and inflammatory response is the first step in our body healing itself. And we just want to manage that and help keep it under control. We don't want to, get rid of that inflammation. So popping pills has really not been shown to be beneficial, for healing with this kind of injury.
Yep. So I think if we can take a big point away from this is you want to keep moving, right?
Absolutely.
So that's one of the bigger things.
And the last thing, one of the last myths is that you need to get an image. You need an X-ray. You need an MRI. And I tell a lot of people this, any good clinician worth their salt, even a first-year orthopedic student, I don't care whether you're a PT or an MD, with basic diagnostic clinical skills, you should be able to figure out and narrow down what exactly is going on. I'll be honest with you guys, it's not magical. We're not, I think we're pretty smart, but it doesn't take geniuses to figure out if it's a disc issue, if it's a muscle, or if it's stenosis and arthritis, things like that. I'm looking at the most common causes of back pain. We can figure that out really easily. And oftentimes people are so sold on getting an image. It's not that the image isn't going to help. It's just that we think that they create thought viruses where people hold on to whatever finding is there. And in reality, a lot of the findings are going to be normal for most people anyway.
Yeah.
So it's like, why go through that step? Why wait any longer? Don't put you in an uncomfortable position. We know what's going on. So let's just get the process started with healing.
Yeah. I mean, finding things like arthritis on your lower back and finding things like a bulging disc on your lower back, it's like finding gray hair on your head. They happen to everybody and they happen over time.
I've never heard
It's a good one.
Actually, that's good.
It's a good one. So
I'm stealing that one as I write it down.
All right. So those are kind of some of the biggest myths about low back pain. And we want people to really know is, hey, you know what? When you start to feel something in your low back, the most important thing, as I've already said, is to keep moving. So I think that moves us into what you should do with when you start to have some low back pain or whatnot. So number one, we say no more than 48 hours bed rest. Okay. And to keep moving, move the best you can. Get up, walk around. And do the activities that you can tolerate. And every once in a while, moving into a little bit of pain is actually not a bad thing.
Right. Keep in mind, we can't say that enough. Sometimes moving into discomfort is a good thing. It can help start that process. Okay. Sorry, what do you do in the morning when you're stiff and you wake up? You slowly get yourself moving, and it helps loosen you up. Well, if you're in pain constantly and you just kind of don't move and you take smaller motions and you don't do much, you do less and less and less, your body's just going to perpetuate that stiffness. It's just going to be a snowball out of control.
And sometimes every once in a while when somebody has back pain, they move into these protective postures. So like they start to shift their hips over. Yeah. And like this right side hurts, I start to move. And then they get stuck there and they can't get up straight because they've never wanted to put pressure back on that side. Mm-hmm. Sometimes what we find is slowly re-implementing some pressure helps desensitize it. It helps it not be as uncomfortable, not as painful. And it may take some time, but that's what you have to think about. You don't want this area to say, hey, I don't want to put pressure on it. I don't want to open like that rusty car door. You want it to move.
Yeah. The longer you adopt those avoidance behaviors, the longer it's going to take for your pain to go away and your function to restore. The analogy I use there is you move into a new neighborhood and you have children. Well, if you're unfamiliar with the area, you perceive a threat, you're not going to let your kids wander far. But the more and more you get used to the area, you see, oh, there's nothing wrong here. They're not going to, get themselves into trouble. You let them wander farther and farther. They ride the bike down the street, next door, things like that. So the more you gradually expose your body to those painful areas, the more and more it's going to respond better and you're going to be able to do more.
Absolutely. So on to the next one, like thinking about stretching, right? So we already talked about stretching a little bit, but what are some of the reasons why we don't necessarily want to stretch?
Are you asking me or are you asking them?
I'm asking you. Why not? Okay. Why not? I'm throwing questions at you.
Yeah. So what I wrote when we were doing this blog is it's all about blood flow, getting blood flow back to the area. So how can we activate the muscles? Blood is where you get all the healing properties, all the good stuff, all the good juju to the area. So again, we don't want you to just stretch for the sake of stretching because the muscles don't always respond to that. Instead, we want to strengthen them. Start to engage them. So, after a surgery, we talk about people activating the muscles to get strength there. Strength will help support the area. And in order to strengthen, we need to stop aggravating it. Think about if you have a paper cut on your knuckle, what happens if you keep bending it? It's going to hurt like hell. So instead, why don't we let it heal in that shortened position? And like Ashley talked about, different movements. If bending forward bothers it, well, maybe we should try and shorten it instead. So this is where we talk about directional preferences. Ashley, I don't know if you want to talk about that a little more.
Yeah. So, when we talk about directional preference, it's basically finding the position. If you have, say, radiating pain, and there's an area kind of in a post about this, but if we talk about radiating pain, like if you have it, it's going into your butt and then going down your leg, what we really want to try is to find that position or those movements that help it come back up, right? So that's what we're kind of looking for. And the thing about this is that it may become more painful in other areas, right? But we want that increase in pain to be further up, away from that farthest point.
Yeah.
Right? So what we'll do, and like, John, if you want to kind of run me through it, sometimes what I do is I move people through this series of movements to try to find it. And I think I've moved people through mainly 4 different movements.
Actually, you know what? This isn't something we talked about. This would be a good point for brevity's sake. Why don't we allude to it? And we're going to start. A social media series on this right now.
Yeah, it's awesome.
Okay, yeah. So guys, understand that the take home is that there is a series of movements, a battery of tests that we put everybody through, and it's unique. I mean, it's not unique to each of us. It's consistent. Whether it's Ashley, Justin, myself. We hope a number of other clinicians. But they're movements that we're going to take you through. And so if you tune into our social media, this is not a shameless plug. This is an intentional plug to get you to our Facebook feed and social media. Take a look at those, and we'll have you, we'll have you be able to see them a little bit more, pardon me, a little bit more succinct. But Ashley's right. If there's pain farther away from you, the goal is to get that pain back up. Almost think of like a suction cup sucking the pain from your foot all the way back up to your low back. And in the blog, like Ashley wrote, it's called centralization of pain. Even if the pain gets more intense in the low back, but you don't experience it as far down, that's textbook centralization, and that's a green light all the way. That's what we always look for.
As much as it can be a pain in the butt, it's okay.
Yeah, exactly. So the don'ts, we have all the myths. For the do's, we have keep moving. Don't rest too much. Obviously, you always want to keep moving. We want to move into a directional preference. So we're going to help you find what areas can help you desensitize your pain, which will allow you to move more. And we're going to want you to strengthen. So get those muscles going. We tell everybody, if you come in with back pain, be prepared to learn how to squat, carry heavy weights, or deadlift. I think those three things are very common for all of us in treating low back pain. It's very counterintuitive, but we want you guys to know we got to get you moving. Back pain is not a death sentence that it's been kind of painted as in this country over the past who knows how many years. People come in with back pain, and I'm like, okay, cool. Join the club. Let's get you moving a little bit. It's really easy to fix, and people are usually like, what, really? Yeah. I can squat? So
yep. People are hesitant to move with back pain, and I think that's the one negative thing that has kind of come out of some of the medical models, is that, hey, you know what, go sit in bed, go bed rest, go heat, ice, put TENS on.
Yeah.
We rarely ever hear say, hey, go out for a 20 or go out for a 10-minute walk.
Yeah.
Or, hey, try to move a little bit. Try to still do some of your exercise, because that's actually going to be what's best for you.
Yeah. I mean, what's the one thing that, after rotator cuff surgery, you have to strengthen? Think of a professional athlete who pulls a muscle. They have to strengthen that muscle. You injure your back, guys, rest is not going to cut it. You have to strengthen. There's a reason it got injured in the first place. So I think that's long enough. We've kind of left you with some good info, hopefully, a few laughs, maybe two, and maybe some WTF moments, but
right? Which I think is our whole goal with this.
Yeah. We've gone stir crazy. We're sure you guys have too. So
absolutely. All right, guys. So hope this helps.
Yeah.
All right,
guys. We'll see you later.
Bye.
Whoop. And what's good for another laugh is me hitting the wrong button. And we're done.